Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nirav Pandya, Dr. Brian Feely, and Dr. Drew Lansdowne, discussing hot topics in sports medicine and society. Welcome, everyone, to our UCSF Sports Medicine Podcast, 6 to 8 weeks. Myself, Dr. Nirav Pandya, Dr. Brian Feely, and Dr. Drew Lansdowne. Today, we have the pleasure of having Dr. Brian Sutterer on. He's very well known for his injury videos. He's also a PM&R fellow now, correct?
Yep.
So once again, we really want to talk to him about kind of what he's created, from a social media standpoint, also talk about his training and kind of where he's going to next in terms of his career. So Brian, thanks for joining us today. I really appreciate it.
Thank you very much. Pleasure to be here.
So maybe just start out, tell us a little bit about your background and what got you into medicine and sports medicine in particular.
I took a pretty unusual path. Actually, my background is in engineering before medicine. So I started undergrad with zero intention of becoming a doctor. I studied mechanical engineering and then biomedical engineering for my master's degree. And then was just always fascinated with kind of movement and just this idea of sort of the biological machine and complexity of the human body. And that's sort of what ultimately got me into sports medicine. I was interested initially in orthopedics. Couldn't cut it as an orthopedic surgeon. Props to you guys for doing what you do. And thankfully kind of luckily found my way into physical medicine and rehab as ultimately getting to be my path into sports medicine. It's been great ever since.
So I think a lot of people know what sports medicine is, but they don't understand what PM&R is. So and it seems to be one of the broadest and most quickly growing fields right now. So What are some of the subspecialties that you can do within PM&R, and what do you, I don't want to turn this into a job interview, but what sort of things do you want to do?
That's a great question. And it's part of what makes it hard to explain, when people say like, what is a physiatrist? Because you're right, it's probably one of the most diverse fields. I think in general, I like to think of it as we are specialists who treat patients who have typically some sort of pain or disability because of some injury or diagnosis involving the neurologic or musculoskeletal system. And, the two general halves, there's the rehabilitation part, that's like the spinal cord injury, the traumatic brain injury, the stroke, the pediatric rehabilitation. And then you have this whole other kind of separate pathway that's the physical medicine side, like the sports medicine. Interventional pain is a pretty popular fellowship choice for folks. So you can really kind of take whichever of those two pathways you want. But the nice thing that I like is it's all kind of grounded in this approach of the whole patient. We don't have to focus on just one specific part of the body or one specific organ system. We kind of are able to look at the patient as a whole. And our whole focus, we always talk about quality of life, improving function, are kind of the two fundamental tenets of the field. Lots of procedures. That's kind of personally what also drove me into the sports medicine side and what I want to do. We have really good diagnostic ultrasound training, ultrasound procedural training, doing a lot of really cool kind of mini surgical, in-office procedures that are really exciting in the sports medicine world. So going forward, I really want to do more of that. I think also being an engineer, I really like the hands-on side of things. And thankfully, PM&R kind of lets me do that in a way that I don't have to be in the operating room every day.
And how often do you work with, other specialists in either surgical, non-surgical fields, and who do you work with most commonly?
In the hospital, pretty frequently. So on the rehabilitation services, they're all the time working with the neurosurgeons, the orthopedic surgeons, et cetera. In specifically the sports medicine PM&R side, our offices are right there. We share a workspace with the orthopedic surgeons. And so pretty much on a daily basis, they're coming in and saying, hey, I've got this patient. There's something that's kind of clicking or snapping on their knee. I don't really know what it is. Could you guys take a look with ultrasound and kind of help us figure out dynamically kind of what's going on? Adding on procedures, injections, patients who maybe aren't a great surgical candidate for something like a knee arthroplasty. We're sort of the ones in our institution who kind of do most of the orthobiologic kind of regenerative medicine discussions as well. So pretty frequently.
So you just said clicking in the knee. So do you diagnose plicas? Because Nirav is trying to become the plica expert on the West Coast.
There you go. Yeah, we certainly have. Yeah, we've looked at them a lot with ultrasound. We'll sometimes, I know, sometimes you can just inject the joint and hopefully that kind of gets rid of the problem. But we've done some where we actually go in and, identify where that little piece of plica is snapping and actually target that itself with an injection. So yeah, we've seen a handful of those. Sounds like a interesting little pathway.
Yeah, that's half of Nirav's practice.
Right.
Just snapping knee plicas.
Okay, yeah. I'm waiting for the first NBA player to miss a week due to a plica, so we'll see.
There you go.
So kind of switching over to your videos, Brian. I mean, obviously they're very well known. You have a huge YouTube following, and there's a handful of people who kind of do injury analysis like yourself. When did you decide, like, tell us kind of the origin story. When did you say, hey, this is something that I want to do, and there's definitely a need, there's a market for people to kind of want to understand the information part of things?
Yeah, I started in residency doing more of just like a day in the life of a medical intern kind of vlog where I talked about my medical rotations, did some videos about PM&R to try to get some people more exposure to it. And in the back of my mind, I was always thinking, I like you watch, we're all sports fans. We watch Sports Center and we see them try and fumble their way through some description of, oh my gosh, they got IV antibiotics in their body, and everybody freaks out. And so I always wanted to do more of that. I just never thought that there was enough of an appetite in it. And so I kind of thought I'd have to pepper in like individual little videos as things came up. And I specifically remember it was when Markel Fultz, diagnosed with this thoracic outlet syndrome. And I got all these messages like, what in the world is thoracic outlet syndrome? People were sharing like Wikipedia links to stuff. And I thought, this is a perfect opportunity. Like, I understand what this is. I can explain it in very simple terms. And, I think I got like 100 times the views on that video that I had on anything like the past year on my YouTube channel. And so I thought, great, this is more fun for me. I enjoy doing this. I get to learn a lot whenever I'm preparing and working on making these videos, and people seem genuinely interested and curious and learning about medicine. And so just kind of took off with it from there. And it's been great ever since. It's been a lot of fun.
It is interesting when you kind of look, and you obviously know this, there's kind of two schools of these injury analysis. There's the educational one, which you do a phenomenal job of. And then there's like the fantasy sports betting aspect of things. Like, look at the video, tell me exactly how long these people are going to go out. Where do you find the balance between those two? Because I feel that also someone also does social media. There's people who are like, oh, great, thank you for educating me about what a meniscus tear is. And there are people like, when exactly are they going to come back? Like, what does this mean for me?
Sure.
Doing that.
That's a great question, and something that I wish was talked about more in this space as it's starting to grow, because I've personally always been very strongly of the belief that we should not be talking about gambling stuff and fantasy sports, just because, I think as a baseline to begin with, it's, we're kind of in a little bit of, depending on how you go about this type of stuff, in a little bit of a gray area, just with the ethics of, speculating on things sometimes, trying to go off of what we have and try to be as objective as possible while teaching, but not being like, oh, he's got arthritis, his career's shot, when like, honestly, we have no clue, based on what we see in the news. And so I've always felt pretty strongly that it's not, okay for me to be giving people gambling advice based on just like my very simple, objective thought from what we see in the news. And so I've tried to stay away from all that. And thankfully it's worked out really well. I rarely even will talk about like recovery times for stuff, just because I'm so, I don't know if this lateral ankle sprain has an osteochondral defect or something that's going to put this person out for the year, or if it's just going to be like 2 weeks. And so thankfully I've been able to kind of stay away from a lot of that, who should I draft, grading people, and just kept it purely educational. What is this? What are some anatomy pictures? What are doctors thinking of? What's our differential? What are some general, surgery, no surgery types of thoughts? And I've been very fortunate that I, haven't felt that pressure to go down the fantasy sports route.
All right. So I guess last week, Warriors are playing the Suns. I noticed your skeleton is wearing a Phoenix Suns shirt. So now I'm worried about what your real allegiance is and whether or not you need a Warriors jersey.
Yeah, so I probably have, I would say, so the jersey on here now, this is probably like my baseline favorite, just because I grew up in Indiana. So Larry Bird, my wife went to Indiana State. But I've probably got, I'm looking like behind in my closet, I've probably got like 15 or 20 different jerseys. So that's like the one thing that I try to change up in my videos. I'll put on like, try to keep the same sport with what's going on. And then if I have like a jersey of the specific team, I'll put it up there, and it makes it fun, kind of changes things up a little bit. I think I have an old throwback Steph Curry jersey, but it's like a child small, so it's hard to get on and off.
Okay, so Steph Curry is not throwback. He's only been in the league about a decade. We need to get you a Chris Mullin jersey.
There we go, yeah.
So my question, I know he's before your time. So my question is, Devin Booker gets injured, and he pulls a hamstring. And within what seems like 15 minutes, the game is still going on. Not only have you analyzed the injury, looked at clips, but then you have something up on YouTube. So how do you do this so quickly and so efficiently? Whether it's, how do you find time in the day versus making the videos look so professional?
Well, thanks. It's been a lot of practice. I can tell you when I first started doing them, it took me, 4, 5, 6 hours to do a single video. And I think part of what allowed my channel to grow so quickly was just the speed, because people are, something happens and the first place people go is YouTube. And so my goal is, well, when people are searching Devin Booker on YouTube, I want my video to pop up as quickly as possible. And so, the nice part is the stuff we're talking about, it's not overly complex. A hamstring is a pretty simple thing. And I've got a lot of pre-made like anatomy models that I can go through. I've kind of refined my whole process with some of the technical side of things, where I think I got that video done in like 30 minutes. And so that was a case, I'm sitting in my office, I'm working on stuff for fellowship, and tweets start popping up. Oh, Devin Booker, out with an injury, they're calling it a hamstring. And I just kind of flip a few switches on my camera, turn the lights on and hit record and just talk for 10 minutes, edit it down to 5. And definitely not what I was doing when I first started. When I first started, it was like taking forever and really slow. And so learning the just YouTube editing, like video, I've got like 4 lights in front of me and like lights all here behind me, just getting all that set up has been a lot of fun as well, but definitely part of what makes the whole process, I think, easier and hopefully looks more professional.
Yeah, you can see Nerev's lights right now. It's very professional, sitting in somebody else's
No
office.
judging. I won't judge.
Great. And Brian, how do you decide which injuries to analyze? Like you mentioned, you saw this popping up on Twitter, but there's injuries all the time, and you're having to pick and choose. And what catches your interest?
I think the first thing is always just time. I mean, of course, there's a lot of moments where just with fellowship, it's late, I'm tired. I'm not doing it right now. But I think the rest of it is sort of a bit of a game at times, certainly with YouTube being a visual media, everything is about your thumbnail. And so there's a lot of moments where I've thought, well, is this going to be interesting from a medical standpoint in terms of, do I feel like I can provide basic information with some interesting anatomy pictures and have something to contribute, but also is there something that visually people are going to be interested in? Because if there's something that, all we have is a tweet or a story from some NBA writer, but there's nothing like visual, there's no real footage, nobody's going to YouTube to get their news. And so I try to think of, do I have the time? What's medically interesting? And then what's something visual and eye-popping? There was like a year ago, Kansas City Chiefs game, Tyreek Hill's on the sidelines and he's got a little like shooter of pickle juice, and the cameras just happened to catch him like laying on the bench, and he's like throwing back this little shooter of pickle juice. I'm like, that's perfect. Like that's a perfect image that people are going to see. They're going to be like, what in the world is he drinking? And it was an opportunity to talk about cramps and like some of the research out there on why pickle juice is effective for cramps. And so trying to kind of find that balance of visually interesting stuff. That's why I think UFC videos and like boxing are some of the most popular on my channel. But then also, what can I bring some little simple medical tidbit to that is not so overwhelming that people are going to get like exhausted and not want to watch it all?
What are some of the pitfalls of social media you found? Obviously you can see on Twitter, there's always, for every 95 great comments, there's like 2 that'll find a way to like cut down what you're doing in general. Yeah. What are some of the pitfalls you've encountered as kind of going through this process?
Yeah, you have to have a thick skin. That's for sure. Sports fans are pretty darn passionate and can get pretty angry, if you say certain things. And I think the hardest part along the way is remaining a fan while I'm trying to be professional with some of this stuff. And so there's a lot of things on Twitter where, I've deleted a lot of tweets where I'll like tweet something as a sports fan and then think, wait a minute, like people are here on my Twitter page because I'm a physician, not because I'm Brian Sutterer, sports fan. And I'm like, that's probably a little bit, I shouldn't really say that. Someone's going to take it the wrong way. There's been a couple of times where I've said some things in like interviews and have had to learn from it of like, well, that was probably a little bit too much of the fan in me talking as opposed to the medical doctor in me talking. And thankfully that stuff happened, kind of early on enough in the process that I could kind of learn from it. But it is a hard balance because we are kind of at the end of the day, there's somewhat of a speculation sense that's coming into this. And, people latch on to everything you say as a doctor. It doesn't matter how, kind of frivolous what you were saying or how much you were just kind of kidding around or being a fan. If I make some little comment of, so-and-so could have arthritis in their knee, I have to say that with the knowledge that SportsCenter could like clip my tweet and say, sports doctor says so-and-so has arthritis. And then it, blows up into this big thing. And so just having that constant mindset and awareness that whatever you say, you have to say it with the knowledge that it could end up on like national TV, and then being okay with saying it, I think is important.
A recent example, speaking of the Suns, the Suns, after the Suns beat the Warriors the first game, I tweeted something out. Oh, the Phoenix Suns have won a championship, never. And then literally,
Just
then like it was retweeted, and so like the doctor says the Phoenix Suns are bad. So
yep,
like
exactly.
it's like you have to, that fine line between fan versus is medicine is definitely something you have to toe the line.
Yeah, for sure.
Okay, but as a doctor, I've also seen Dr. Pandya tweet out that he's eating donuts for breakfast, that he drinks about a gallon of coffee before clinic, and Steph Curry plays basketball tonight. So I think it's okay. And I tweet out pictures of inflatable dinosaurs on my roof. So I think it's okay that we find a balance. So how do you see your skill set translating to patient care? Do you feel like you being able to do these videos, provide information, either helps you talk with patients or set you up to have a different way to reach more patients as you transition from fellowship into your own practice?
Yeah, it's definitely helped on the patient education side of things, just because, I make my videos with the intent that high school kids are watching them, or, 30, 40, 50, 60, whatever year olds with. Basically, they maybe took a science course at some point in high school. That's kind of what I go into them with. And so it's definitely helped me learn how to kind of simplify things and explain things in a way that hopefully people will understand. And the pure sports side, it's been great. I mean, I've had some kids at like our high school, at our training room that I cover for fellowship, that you'll kind of see them like look at you and they're like, okay, I think they think that like I'm so-and-so, like they've seen me. And then they'll like, oh, are you the guy, on YouTube or whatever? And there's kind of this immediate, like they relate to you more because they see like, oh, you're a sports fan, you watch sports, you know about this stuff. I think it's nice, if I have a young athlete in my clinic room who just tore their ACL or has whatever injury and they play football, I'll try to get a sense, okay, who's your favorite team? Oh yeah, Dalvin Cook like had a shoulder dislocation like just a couple weeks ago. So like this stuff happens to the pros, and just being able to kind of get them a little bit more interested and realize that like this stuff happens to other people. This stuff happens to the people that they follow and watch on TV and social media. I think just gets them to kind of buy in and like you more as a doctor, because you're kind of doing stuff that and watching stuff that's a huge part of their world. So I think it's been great in that sense. I'm still curious for the patient who doesn't really know what YouTube is, who just Googles me and sees like YouTube doctor. That's kind of interesting, like what they would think coming into my clinic. But so far it hasn't caused any issues.
So Brian, what are you doing next? When do you finish fellowship, and what do
Great
prospects
question.
look like on the horizon?
That's the $1 million question right now. I was just last night, I was going through and editing, like fixing up my CV and everything for job applications. So I want to work. I don't know yet. I'll finish fellowship at the end of June, and then I'm just starting to look for jobs. I definitely want to stay in the academic world just because I like the teaching. We at Mayo, where I am now, we get to work with residents so much that it's just a great experience. And so I want to be somewhere where I can help teach, help be involved in resident or fellow education. I'm not so much a heavy researcher, and so I don't see that being a big part of my future, but I definitely want to keep growing the media stuff. I mean, it's great that YouTube kind of lets me control and do what I want on my own, but I'd love within, 5-10 years to be doing something for a bigger outlet, or doing more writing contributions for somewhere to kind of be like, the thing I tell my grandparents is like the Sanjay Gupta of sports medicine is sort of like the 5-year down the road, 10-year down the road kind of role that I'd like to continue kind of carving out for myself in the space. But clinically, I want to keep working on the procedural stuff. I really like the, getting to do more now, like 10X, tenotomies, PRP, the MFAT, that kind of thing that we're starting to, get more exposure to here in fellowship as I go through the year and get better with things. So we'll see. I submitted my first application last night to a program back in my hometown that a little excited about, but it's such a new kind of nerve-wracking experience. It's like the first time in life that you don't just have a list of 15 options of where you can go and you pick. It's like I have to go find it on my own, so a little stressful. If you guys have any great pearls, I would be all ears.
No, I'm sure with your skill set, especially with sports medicine, there's such a need for people who are providing the kind of care that you will. So I'm sure the market will be very, very robust for you coming out.
Oh, thanks.
Awesome. Well, Brian, thanks again for joining us. Don't want to take up too much of your time. Really appreciate it. Keep up the good work. And I'm learning from you as well, too. Learning your videos. I'm like, I didn't think of it that way. So once again, thanks.
Appreciate it.
Yes, appreciate it.
Yeah, thanks, guys. It was a pleasure meeting all of you. Have a good rest of the day.